In a township called Alexandra, a wave of sickness has raced through the community over the course of the past 2 weeks. But nobody's calling it Omicron. Instead, the residents of this impoverished part of Johannesburg are using a more familiar term, the flu. This is Muzi Linda.
Can you take me through the symptoms?
Well, I've had a headache, blocked nose, wasn't too runny. I've been coughing.
He knows it's COVID. He tested positive last week, but Muzi doesn't seem too concerned.
On a scale of 1 to 10 for severity, what would you give it?
A 4, honestly.
A 4.
Because it wasn't that bad.
The Omicron variant was first identified by South African scientists, and the people who live here are now experiencing it. And its infectious nature is clear. Alexandra's local councillor says it's moving at an astonishing speed.
Very fast, like a bomb.
Have you got a sense for how many people have been infected here?
A lot of people. I mean, on a daily basis, I interact with around 100 to 200 people, and I talk to a whole lot of them, and via WhatsApp, via phone call. Some come straight direct to me. And a whole lot of those people admitted, the majority of them, that they have flu. Thousands of those people. The majority of those people were all saying that they have flu.
The consequences of an illness caused by Omicron are less clear. Some here say the symptoms aren't that serious. Others don't seem to care.
To us, it's like serious flu because it's raining and it's cold. We think that's all it is.
So people aren't really taking it that seriously?
No. Even now, see, I'm not wearing my mask.
Omicron may be classified as a variant of concern, but that doesn't mean much to the residents of Alexandra. As far as most people here are concerned, there's a bad case of flu going round. And if they get it, well, they'll get over it.
Okay, cool. Let me have a look at it once it's done.
I'll do that.
Okay, thanks.
When it comes to the new variant's real-world behaviour, Dr. Farid Abdullah probably knows more than anyone.
Hi there. It confirms my picture all the time. Hey, this is not what we had before.
We found him in the capital, Pretoria, staffing the hospital's COVID assessment centre. And he told us they're seeing fewer people admitted with the most severe symptoms.
Yeah, so right now we have 40 patients, either COVID positive or waiting for their results. But the difference this time around is that the majority of these patients are not here because of a severe COVID pneumonia.
Most Omicron patients spend fewer days in hospital, and he says they're less likely to require oxygen or ventilators.
So the picture could change, but what's certain is that there is a difference this time around compared to the previous 3 waves.
You can say that with some confidence, can you? There is a difference.
There is a difference.
After several weeks of mass infection, Omicron has shown its cards, although the country's hospitals and clinics have managed to cope. But if the numbers of infected continue to rise, they may struggle to deal with the consequences.